Welcome to iCare, Infection Control Advocate and Resident Education. In this lesson, we will cover common infections in nursing home communities. We start off on a sunny afternoon at the Springville Nursing Home. Stella Johnson is a resident at the Springville Nursing Home, and her youngest daughter, Monique, has come to visit. During her visit, Monique finds that her mother is taking medicine, antibiotics for an infection, the second time in 2 months. Monique is concerned and wonders, why does my mom keep getting infections? Is this normal because of her age? Can anything be done to keep my mother off of antibiotics? After this lesson, you will be able to answer the following questions. What causes infections and illness in nursing home residents? What are the most common infections in nursing homes? What happens when a resident gets an infection? And lastly, how can being informed and involved respect resident rights while preventing and controlling infections? So why do nursing home residents get infections? Well, many times it has to do with getting older and your immune system not being as strong. Of course, many times with age, people have more chronic conditions, and this can make them more vulnerable to infection. Many times, older adults have to undergo different procedures and treatments because of chronic conditions. For example, using a urinary catheter, which is a tube placed in the bladder to help people urinate. This tube can allow bacteria to enter a person's body more easily. Disability, or not being able to do daily activities like walking, eating, or going to the bathroom independently, also increases a person's risk for infection. For example, not being able to move makes already aging skin more vulnerable to tears and ulcers. Again, germs can then more easily enter the body. Lastly, living arrangements such as living with groups of people or being moved from one place to another to get care. This puts people at greater risk because it allows people to have more contact with others and environments that can have germs. Of course, all of these things taken together just increase the risk of older adults in getting infections. The most common infections in nursing homes include respiratory infections involving the lungs, urinary tract infections, because many times older adults cannot empty their bladders completely, or they have a catheter in place to help them urinate. Diarrheal infections, because older adults in nursing homes have contact with many people, people who have trouble going to the bathroom, and people who help them go to the bathroom. This increases the chance of spreading germs that can cause diarrhea. And skin and wound infections. Again, because skin is so fragile as we age and as we move less. There are 4 main types of germs or microorganisms that can cause infections: viruses, bacteria, parasites, and fungi. Below each type, some examples of these bad bugs are provided, and you can learn more about them in the information sheets provided with this lesson. Once a person gets infected, what happens? There are a few different things that can happen. You can get an infection and not get sick, so you don't have any signs or symptoms or feel sick, and the germs can go away, so your body gets rid of it. You may not even know you had an infection. But you can also get sick after an infection, so you don't feel well. If you get sick, you can get better because you get a treatment like an antibiotic or other medicine, and that helps your body get rid of the infection. You can also get sick and not get better, meaning a person passes away from the infection and from getting sick. Lastly, you can get an infection and not get sick, but the germ does not go away. That germ sticks around in or on your body, although you feel fine. If something changes with your health, like you get a wound, that germ can get in your body and make you sick. The main point here is that even if you don't get sick, so you feel fine but have an infection, you can still pass the germ to other people. So you don't have to feel sick to spread germs. So now that you know about why nursing home residents are at greater risk for infection, what those infections are, and what happens if a person gets an infection, what does that have to do with resident rights and responsibilities? Well, all residents, those closest to them, including the nursing community's staff and administration, want high quality care and deserve an environment that promotes high quality care. But care cannot reach its highest level of quality if a nursing home community is not preventing and controlling infections, which we know can have a major impact on a resident's overall well-being. And as all nursing home communities experienced during the COVID-19 pandemic, infections that are not controlled in some nursing home communities can result in changes that impact a resident's rights in all communities, such as visitation and freedom to participate in activities. Residents and their families have a right to quality care. When nursing home communities work side by side with residents and those closest to them, such as family members, to prevent and control infections, this demonstrates a commitment to quality care that preserves and promotes resident rights. When infections are prevented and controlled to deliver high-quality care, two major resident rights are protected: being informed and involved. Being informed includes getting information in a language you understand about an infection you may have and how to prevent spreading the germ to others. Being involved in all decisions that affect your care, such as the medicines you take, any treatments given to you, or any other precautions to prevent the spread of infections. This helps you understand what is needed to prevent infections and helps you decide what treatment is best for you and even refuse a treatment or service if you decide, with the help of your healthcare team and others, that that's the best step for your overall health. Having a strong program in place to prevent and control infections is a major step in providing quality care in nursing home communities. Federal and state law requirements provide information to nursing home communities so they may have an infection prevention and control program which has a system for preventing, identifying, reporting, investigating, and controlling infections and communicable diseases for all residents, staff, volunteers, visitors, and other individuals who provide services. Promotes appropriate antibiotic use that improves resident outcomes and reduces resistance to antibiotics by germs, and includes a process to record and correct any incidents related to infection prevention and control. So let's go back to Ms. Johnson, Monique's mother. Ms. Johnson has a right to be informed about her specific condition and why she is on antibiotics again. Ms. Johnson also has the right to be informed about common infections occurring in the nursing home and the facility's plan to prevent them. While age can lead to changes, including chronic conditions, older adults are not destined to have infections, and prevention and control measures are important to stop the spread. Infections can lead to serious but preventable outcomes. And while Monique is concerned for her mother, it's up to Stella, Monique's mother, to decide how much involvement she would like her daughter to have in her care. Ms. Johnson has a right to be involved in her care planning, including care to prevent infection and ask about any treatments she is on. Ms. Johnson also has the right to refuse any treatments, services, or care as long as those decisions do not harm other residents. For example, if Ms. Johnson was asked to be on a urinary catheter because she has issues with controlling her bladder, she can refuse the catheter. This may help keep her off antibiotics, and a facility must promote practices that can limit antibiotic use, as excessive use of antibiotics can lead to resistance in germs. Thank you for watching this lesson. Please see the iCare website for additional lessons, information, and support.